the early learning and, oh, thanks, Beth. Thank goodness I made Beth a co-host. Those details, not so good at that. So just a reminder that the Early Learning and Development Committee is devoted to strengthening the integration, accessibility, and quality of early childhood services in Vermont. So that's our purpose. Those are included in the agenda. There's a longer description, but that's just a grounding to get started. And right, so let's start with our introductions. And Nicole, I'll start with you, the co-chair of this committee.
Sure. I am Nicole Dubuque. I am the Policy Director for the Child Development Division within the Department of Children and Families, and I am the new co-chair of ELD.
Nicole. And Linda January.
Hi, I'm Linda. I'm the Executive Director from Otter Creek Child Center in Middlebury and one of the co-leaders of the Addison Early Childhood Network, the Directors Network. And am
Linda,
I supposed to?
Yep. Did you have any lingering questions or thoughts or any?
So I think my big takeaway was that it's just a great research document. Like, I just think that there's a lot of good things that can come of it. So I guess the question is, how do we take that and actually turn it into action and change for children?
Thanks. Shelley Henson.
Hi, I'm Shelley Henson. I'm the Director of Early Ed for the Champlain Valley School District. I'm also the Interim Secretary for Vermont AEYC. I've been on the board for 5 years this time. I was on it a long time ago for many years. So, and I'm just trying to think about lingering questions. I guess I often think about the fragmentation of things. And so I know there's a lot of different things happening at the same time. And I know that many of the people in this group are in other groups. And so I just wonder about the coordination and all that. And I'm positive that it's on everyone's brain. So, but just on my brain too. So.
Thanks, Shelley. Is Diane Nichols Fleming with us?
Yes.
There
Good
she
morning.
is.
Yeah.
Good morning.
Hi, I'm Diane Nichols Fleming, the Early Childhood Program Coordinator for the North Country Supervisory Union, which is in the Newport region. And we were one of the groups, the sites that was part of that report. And so our group, our leadership team of early MTSS met, and we were reviewing some of the things, and our lingering questions are, there were several big things that we took on that we don't know. I mean, we're figuring out how to continue that work, but we would like to see what that sustainability portion of it means. And so they had the nice year plan put out there, but what does that mean and who is really taking it on? Because we do have some lingering work that we're continuing to prod through.
Thanks, Diane. So for those of you that either are on the phone and can't see the chat or joined a little bit late, we're doing introductions because we didn't take time to do that in September due to the structure of the agenda. And we're just sharing either something, a strength of our early childhood system or services in Vermont, or if you attended and want to reflect on the presentation we had last month from the UVM team around supports, around supports for young children and their early MTSS project and the PIES report, you could reflect on that. So I don't know if Wendy Cunningham is here. She was tentative. I don't see her. So we will move on. Is Lori Metcalf here? Becky Millard.
Sure. Good morning. Becky Millard. I'm the Director of Northern Lights at CCV. I'm also the co-chair of the Professional Preparation and Development Committee. So let's see, strength or lingering question. I don't know that I have lingering questions per se, but I sort of echoing some of what I've heard so far, I am really interested in next steps, interested in hearing more, interested in sort of what are we thinking when are we talking about expanding a pilot? Are we really talking about statewide implementation? What might that look like? What might it cost? And how are we going to pay for it? All of those pieces. So it's less a lingering question and more sort of interested in thinking toward next steps related to the project.
Thanks, Becky. Alina?
Hello, good morning, everyone. My name is Elena Gustavson. I am the Director of Business Resources at the Vermont Community Loan Fund. I don't have anything to add. I wasn't able to make the meeting, but I watched the video. It was exciting to hear and kind of start to think through and read through some of that material. But I would just reflect back or echo what others have already said. Just curious about next steps and where do we go from here?
Thanks. I don't think Patty Smith is with us yet. I don't see her. And Janet is not here. Janet McLaughlin from Vermont AYC, but Ann Moore is here. So thank you, Ann, for stepping in and filling in for Janet for today. Janet had a conflict. Sonia. There she is.
Hi, Sonia Raymond from Apple Tree Learning Centers, the owner. I'm also a chair of the leadership team for Lamoille Building Bright Futures. And I guess I would say what I look forward to is one of our strengths is, in my opinion, is some of the collaborations that we have going around the state, including that with our government agencies. And I look forward to and seeing how we expand those and strengthen those as we move forward.
Thanks, Sonia. Is Rose with us? Rose Morrison? She is. Everyone's saying she is.
I am. I put
Oh,
it
there
in
you
the
are. Oh my gosh. Okay, there you are.
Hi, I'm Rose Morrison. I'm Northern Lights Resource Advisor covering Bennington, Rutland, and Addison County. And I hadn't attended, so I
Okay. Pass is always an option
passed.
on the question part. But thank you for introducing yourself. Danielle Harris from the Y. There's a few phone numbers, so I'm not absolutely sure. I don't see Matt Levin.
Good morning, Matt Levin, Executive Director of the Vermont Early Childhood Advocacy Alliance, he, him pronouns. Good to see everyone. I hate to be a broken record. I'm interested in what's next with the study. I do think it's an interesting question, just to dive into that a little bit more. I think it's an interesting question to think about how these studies happen, why they happen, and the interaction between the academic world and the research world and policy and implementation and service delivery and policy development, advocacy and governance. I mean, it's a very, the folks who did it are very open, and it's great to talk with them, and they really show that they're thinking about all those things. So I think it's a natural outcome for all of us to think about, oh, well, that's interesting. We usually get these studies, we look at them, and it's like some far off research entity, and then you sort of move on. And it's nice to have one that's a little more homespun and from people that we know, and so we can talk about these issues. It's a long conversation. It's not like a quick conversation, but like my comment right now. But it's an interesting thing to think about. Thank you.
Thanks, Matt. Michelle Trea.
Hi, good morning. Michelle Trea, the Parent Child Center of Northwestern Counseling and Support Services. And I have to go with the group, and I too am interested in next steps and how they're going with the recommendations. And just, wonder about if there's any other data that needs to be gathered to help inform the recommendations so that we really know the true scope of what's happening in the field to move them forward.
Thank you. Rebecca Bishop.
Hi, Rebecca Bishop. I'm Assistant Director at Bennington County Head Start, Early Head Start. I'm a VACI board member and the co-leader of the Bennington Leadership Starting Points. And I was not, I'm not a regular attendee of ELD, so I don't have information about the report.
Great. Cynthia Green.
Good morning, everyone. I'm Cynthia Green. I'm with Shelburne Farms and Vermont Feed as the coordinator for the Farm to Early Childhood Coalition. And one of the things I've been pondering across many of these committee meetings is thinking about ARPA investments, thinking about this really great research, thinking about that the feds are thinking about Head Start as kind of this template to map onto for ARPA investment and early childhood service delivery reinvention, if you will, that I'm just really curious, how are we as a state thinking about all of these possibilities, and how are we mindfully planning across the opportunities to think about holistically embedding some of these into our system as we're going through these ARPA investments and redesigning. It's no small feat, but I think there's great opportunity to look at this research and look at the opportunities and figure out how to ensure that there's equitable access for all of our programs and all of our children.
Thanks, Cynthia. So Amy Murphy is listed, but I see Kate Rogers is here, but I don't see Amy unless she is the phone number. So I don't know if Kate wants to. Hi, Kate. Are you representing AOE today?
Yeah, so Amy is needed to be at a special ed director's meeting today.
Okay.
I'm sitting in.
Thank you for coming then.
Oh, appreciate it. So, sorry, agents, Kate Rogers, Early Education Programs Manager at the Agency of Education. And like Cynthia, I'm really interested in how Vermont will move forward, given all the opportunities we have right now for investments, especially if the Americans Families Plan is passed and we can reap the benefits absolutely from that for not only childcare, but for universal pre-K and what that means. So, you know, that will, as opposed to like reinventing or redesigning our system, I view it as enhancing and making our early childhood system more robust and very transparent as to what will be occurring for children, you know, in family childcare homes, you know, in center-based homes and Head Start and public schools, you know, wherever they're receiving services in our mixed service delivery model. So I think we're in a prime position to utilize what we have and to make it better. And Vermont is being looked at nationwide in terms of the American Families Plan and what we are doing to support our young children and families. I was asked to be on a panel discussion yesterday with Homegrown and NEAR, which is a research center out of Rutgers University, and to talk about family childcare programs in universal pre-K and how we got to where we were. And states are going to be looking. I mean, California is looking as well. So I'm already having conversations and meetings with them. So prime opportunity to make things that much more promising for our young children and families. So thank you.
Thanks, Kate. I don't think Kim Kaiser is it. Kim, is that it says Kim on the screen? That might be Kim Kaiser. Are you here, Kim? Maybe not. Okay, we'll come back to Kim. I don't think, is Eddie Gale? I don't see Eddie. No. I don't think.
Sherry, I'm on the phone for about 20 minutes and I'll properly get on a screen after that.
Okay, do you want to introduce yourself?
Just Eddie Gale with the A.D. Henderson Foundation, and otherwise don't want to talk a lot while I'm driving.
Okay, thanks, Eddie.
Thanks.
See you soon. I don't think, is Jim here? I don't think Jim is here. Now that the mystery phone call is Eddie. Jim is here. Jen Severance will be joining us at 10:30. And Keith.
Thanks, Sherry. Keith Williams, Director of Children's Integrated Services, part of CDD. One strength of our system is demonstrated here. Everyone is committed to doing what is best for children, which is always refreshing and rejuvenating. Thank you.
Thank you. Thank you all. And I'm Sherry Carlson. I'm the Chief Programs Officer for Let's Grow Kids, and I am the co-chair along with Nicole. And this is our second month of being co-chairs of the Early Learning and Development Committee. And I missed Beth because she's not on my list.
That's okay. Beth Trzanski,
Beth.
Deputy Director, Building Bright Futures, Staff Support. Thanks all.
Thanks, Beth. And I just want to thank all of you. This was great because I have a lot of notes here that I can share with the UVM team, which will help them prepare for that follow-up meeting we have with them in December. And so this was really helpful, and it will set us up, and hopefully we could think about some actions related to some of your questions, at least get answers to your questions, and maybe we can come up with some ideas and actions that we can support as a committee to move forward. Is there anyone that has joined that we haven't, that didn't get a chance to introduce themselves? All right. So we are running a little ahead of schedule, but Sheila is here, and she is first. Our first presenter. Beth, is there anything else that we haven't covered that we should before Sheila dives in?
I don't think so. I think we can keep going. Yeah.
All right, great. So Sheila, welcome, and thank you for coming to tell us about the recovery funds that will be available soon, or are available soon. And if you want to introduce yourself and just start sharing your information with us, that would be great. And I think we'll let Sheila share what she wants to share, and you can pop questions into the chat, and when she's finished, we'll have a little bit of time to ask her some questions before we move on to our next presentation.
Great. Thank you so much, Sherry. And thank you, everybody, for holding this forum, excuse me, and asking me to present. I have been asked to present or give an update on the American Rescue Plan Act funding, which we refer to as Arpa funding. And there are several different ARPA funding opportunities, but today I'm going to talk about the ARPA stabilization funding program and the ARPA discretionary funding program. And they are two very different programs. So both of these programs did require stakeholder input, and we started gathering stakeholder input in March of this year, and then used different forums to gather input for about 4 months till July. We used large group forums, small group discussions, and surveys, internal and external, to gather information about people's ideas on the best use of this money. The first program, ARPA stabilization, is really fairly restrictive from the federal guidance, and that money, 90% of those funds have to go to eligible providers. And eligible providers are regulated childcare and after-school program providers. And so we don't really have flexibility around that. We're running it much like we ran the CURSA program, if you're familiar with that. That program started in April, and it runs to December of this year. So that was a 9-month program where applicants received a monthly check, the same amount each month, to be used in certain categories. We designed the ARPA program, the stabilization program, along those same lines, because the input and that we got from providers is that it was a very easy program. And so this money, we hope, will be available very soon. Just prior to this meeting, I was working on the final slide deck for a tutorial. We are announcing this in a little bit of a different way than we did CURSA, in hopes to get more applicants. So we're developing a short tutorial, and we're going to email the tutorial and the application link to all eligible providers. So everybody will have that in their email box. And then at the same time, we're going to do a public awareness campaign with many of our partners agreeing to assist us to try to get the word out to everybody to look in your email, see if you have an application, because if you do, you qualify for this money. And all you have to do is fill out the application and send it in. And then you'll start getting a check, every month. And so the stabilization program will run funding permitted from November of this year for 12 months to November of next year. And the funding categories are pretty much the same as CURSA. So again, anybody that's familiar with that program will know. Something that is different than CURSA, which is good for applicants, is that there's no monthly reporting. So right now with CURSA, providers have to send in a monthly report in order to generate their next monthly check. That's not required in the ARPA stabilization program. However, we do need to collect information 2 times during the program cycle. And one will be in about April. We'll need to collect information about how much providers have spent in certain categories. And then at the end of the funding opportunity, or if a program ends before then, they'll have to send in that information. Trying to think of anything else that's important to know about this funding opportunity. I think it's the most exciting one yet, because it's the most money that we've had so far. And we've been able to simplify the process even more. So, and we have our partners who are assisting us with pointing people in the direction of the application. So another exciting thing about this is any program that opens and meets the eligibility criteria within the 12-month period, they can apply. So, and then we'll just get them on the cycle of the monthly awards. And that has not been possible in any of the funding opportunities we've had so far either. So there's some components of this funding opportunity that I think make it very exciting for us to deliver and for providers to receive. So do you want me to stop there and see if there's any questions about this, or just go right into discretionary?
Let's see if there's any questions about this funding. And I have one, Sheila. What was, I think you shared this with me and I was trying to remember, you talked about CURSA. Do you know what the take-up rate was for that, for qualified programs?
I think we had, and don't quote me here, but I think we had about a 76% eligible providers are receiving CURSA funds. I'd like to get 100% of eligible providers receiving ARPA. And that's why we're going to try emailing the application and the tutorial right to people. The other exciting part of this program is that we've also extended it to relative care providers, the ones that are regulated and eligible, and they have never been able to receive any of the federal funding that we have managed so far. So that's very exciting too. So we're going to have to make a special effort really to reach out to those providers as well.
Thank you.
Go
There is
ahead,
a question. I was just going to say there's a question in the chat that they can you describe how programs or childcare providers might use the funds?
I don't know if I have came prepared with that right in front of me, but I'll just name some of the categories. Workforce, so compensation for staff in the forms of increased wages or paying for insurance premiums or paying for paid time off, reoccurring retention bonuses, sign-on bonuses. So that's the workforce compensation. And then there's goods and services. There's mental health services for mental health supports or services for children and staff. Utilities and rent. Pretty much almost anything, professional development. I mean, I think pretty much almost anything that programs spend their money on are eligible.
Yeah, I think you mostly covered it, Sheila. I have the PowerPoint in front of me from our last webinar, but I honestly think you named them all, but I can go over them like really quickly just in case we missed one. But PPE, cleaning and other materials to meet health and safety practices, minor facility improvements, maintenance, rent, utilities, insurance, wages, bonuses, sign-on and retention, insurance payments, etc. Professional development, mental health services, consultations for program staff and for children. So I feel like I just repeated. I think Sheila got them all. You don't even need a PowerPoint anymore.
No, thank you. Thank you, Nicole. And the thing of, and the awards are based on, there's a base rate for specific programs. And then there are categories where programs can get an increase to their base. And those categories are, and again, maybe Nicole, if she's got the PowerPoint up, she might have them. But if a program already does one of them, or if they intend to do one of them, they can get an increase in their base rate. Do you have them, Nicole?
Yeah, I do. From the last PowerPoint, I think I have eliminating late fees. Is this the same one?
Yeah.
Yeah, eliminating late fees during program operating hours for the duration of this award, pre-COVID accessibility hours and days, and using some of the award to eliminate copays for subsidy families. I think we also added the wages and bonuses, right?
Yes, and then if a program offers an alternative shift, that they can get an increase. If they serve infants and toddlers, they have an increase. If their program is in a low income area, as determined by the state of Vermont, they receive an automatic increase. And if a certain percent of the families that a program serves come from a minority or diverse background, then there's also an incentive. So again, there's a base rate and then possibilities to get incentives to that base rate.
Get it. Let's complete it together, just because I'm on this state meeting and there's just a couple of things I want to make sure that.
Hey, Lori.
I can't hear you.
Do you want to mute? Lori was talking to, it sounds like she's talking to some staff. Sheila, did you say you can use it to eliminate copays?
You can.
Is that complicated for me to ask?
It is kind of complicated. It's the federal guidance strongly encourages providers to reduce copays. However, you can't use the ARPA money specifically to do that. So if you can use the ARPA money to free up other money that a program has, then they can use that other source of funding to eliminate or reduce copays for children. It is a little complicated, but I think I've said it so many times, it doesn't sound as complicated as it seems.
No, that was very clear. I remembered there was a little a twist on that, but that makes sense. Thank you for that. Any other questions before Sheila jumps into the discretionary funds?
Looks like Diane has her hand up, maybe.
Oh, okay. Yes.
Thank you. So one thing is, I do think you'll have more applicants because the word's been spread about how easy this is. So really appreciate that it's that easy and can really put the work in. One of my teachers described it that she thought it was similar to the mini grants. So she had all of her ducks in a row, so to speak, and ready to apply it all. And then she was like, oh, all I did was this. So I think that word is spreading, and I'm certainly spreading that word out to the community. So thank you for that and for really having that be true. And then the other part though is I did have a home provider. I'm wondering about the formula because I had a home provider who explained that they really got, when we looked at what our school-based preschool programs received, and then I looked at what she received, it seemed to be very different. And, you know, as part of schools, we get a lot of other funding too. So I appreciate being able to use multiple sources, but I wonder if there's a way for a formula to acknowledge some of the extra stresses that are on our home providers as they're doing this work too. And then a question about the poverty, you know, living in an area of poverty, does that automatically get figured in, or does the person need to be sure to ask for it?
Thank you, Diane. All good questions. The base rate is higher for family homes because we understand that because the calculation of the rate does take into account license capacity. I mean, you have to use something you know, consistent for a formula, right? And license capacity is what the federal government suggests, and it's the easiest way to do that. So we do take into considering license capacity, but we also bumped up the base rate for family home childcare providers. And that's strongly recommended in the federal guidance as well. And then I'm sorry, I forgot what else you said. Oh, the low income, I'm sorry, that is already awarded. We have the information from the state, and I can't remember which website or department we used it from, but it's one that we regularly use in our work. And so that is automatically applied. And we do have this cool thing, again, we've never had before. It's called an estimator tool. And so in the right in the application, a provider can go and click on to that estimator tool and answer a few questions. And then they'll get a general idea about what their annual award will be. And so then they can start thinking about, because one of the things that we do have to ask in the application is, what categories do you think you're going to spend your money in? It's not that we hold anybody to it, and they can change, but we have to report this to the federal government. So we have to ask that question, and we asked that question in the CRSA application too. And people didn't seem to have a hard time filling it out. So, but that estimator tool is kind of cool too, where people can see about what their annual award will be.
That's amazing, Sheila. That's so exciting. Very cool. So let's move to the discretionary funds.
Okay, and Nicole her unit is really handling the discretionary funds. So she probably will have more information, and I'll just talk about some basics, and then maybe Nicole can fill in what I've left out and or take questions. So the discretionary funds are a little broader, and we have more discretion around them, but they are intended to build and or expand the system that we have to deliver early childhood and school age programs. And so we use the same kind of information that we received from stakeholder input to develop broad categories for the discretionary funds. And we did have to report on both stabilization and discretionary funds to the legislature. We submitted a report September 1st. And Sherry, I can send you the link to that report in case you want to put it in the notes, and then people can go ahead and read that. But I'll just read the broad categories that we reported on, because with the exception of a workforce scholarship program and a workforce loan repayment program, which were required by the legislature, we really haven't decided any details about the rest of these broad categories. But I'm just going to bring up the report for myself. And so the broad categories for discretionary are workforce supports, supporting specialized needs of children in childcare settings to maintain their childcare placements, business training support for providers, and then capacity building for childcare and school age capacity, and then support intervention emotional, social, and mental health support and training for staff. So those are the broad categories that that we reported on. And again, I don't believe that we have the details of how we're going to utilize the funds within these categories. All of these funds will be distributed through a procurement process, which we're required to use by the state of Vermont. And so anybody who might be interested in knowing about when these opportunities are available, you should make sure that you subscribe to receive the Child Development Division emails. You can go right to our website and subscribe, because that's where we'll be sharing information about these opportunities, as well as the Vermont business. I don't even know what that website is. Maybe Nicole does. But there is a state of Vermont business website where requests for proposals are posted as well. So I'll stop there and see if Nicole has other information to add to this, because these opportunities really sit with her unit.
I don't think I have a lot more to add. I mean, we don't have any of the details here. I can say that as far as the pieces with workforce that were in Act 45, I can speak to where we're at with those two programs for scholarships and loan repayment, which is that we are in the request for proposal phase. For scholarships, we're reviewing bids right now, and this is for prospective students to come into the workforce. And then for scholarships, that request for proposal closes on the 27th. So those are the two programs that we're really focused on getting up and running right now. And then, Sheila just went over what our other priorities are, but we do not have the details of what the RFPs will look like for those yet.
Thank you both. And we have time for a couple questions. If anyone has questions about the discretionary funds before we're going to turn to Kate, it looks like, for the AOE report. So does anyone have any questions for Sheila or Nicole about the discretionary funds?
Hi, just if you'll have a summary sheet of everything that you described.
Sheila's going to give us a link.
Okay, thanks.
Well, I'm going to send you the link to the website to subscribe to funding opportunities. We have not put together a sheet of everything that the larger buckets that we're thinking about using this discretionary money for, but I'm happy to put something together and send it.
Okay, thanks.
I actually have something outside of the report that Sheila's going to send. I have a recent leadership updates that talks about stabilization and discretionary that was sent out to Vermont Early Child Network. So I don't know, that would have been sent to Lorraine, but that would also be like a good overview for this group as well.
And Sheila, you were going to send the report link too, which has a nice.
Yes. Yeah, I will. And when you see it, it was categorized in the legislative website as under fuel or something like that. So when you see the link, you're going to think, well, this isn't the right link, but just go ahead and click on it and it will bring you to the correct report. I don't think it's been fixed yet. It's probably not their priority. They have a lot going on, right? But it will look like it's not the report that I'm sending.
And Matt had his hand up.
I was just going to suggest that there could be the report that was sent to the Joint Fiscal Committee lists all these things, and that could be used as the document that lays all this out, because I think there hasn't been any changes that's been approved by the Joint Fiscal Committee. So in a pinch, that could be used. It's it's very straightforward. There aren't details, of course, Nicole, as you say. I'm not suggesting that there should be, but it's all listed out there. It's all very clear. It's easy to grasp. So that could be sent out as well.
Yeah,
or the link could be sent. It's on the web. It's publicly available. So I could post the link. It could be easily posted in the chat.
Yes, great. Thanks, Matt. If you wouldn't mind just doing that while we're meeting, but we can also send it out. Nicole, Alina had a question if there was any sense of timing where the RFPs might be ready for those other buckets of work.
I don't have a concrete timeline yet, but we're working on it right now. So I'd be happy to get back to this group when I have one.
Thank you. And Matt did put in the chat the report to the Joint Fiscal Office. So you can click on that and bookmark that for later reading. And Kate, we are ready to hear about recovery investments that may be impacting early childhood services at the Agency of Education.
So I wasn't aware that this was on the agenda. So I don't know if I missed that email or what, but I'm not prepared to talk about that. I saw it, it's like, oh my goodness. So what I can do is I can put the link to our funding page in the chat. I will do that. There is ESSER guidance document that would be good to go through. What I can tell you is 90% of the ESSER dollars that have come into the state agency, 90% of those go to the LEAs themselves, the school districts themselves. They have plans and they apply for the grant dollars and then they move them forward. So I apologize, didn't know. So
sorry.
But I will put the link in and I can, Jill Briggs Campbell is our ESSER kind of guru at the agency. And I can certainly shoot her an email to see if she has more specific information on early childhood funding. It's all applicable, of course. But I can shoot her an email and see if she could share anything with us, and I'll email you, Sherry, and you can send it out to the group.
Great.
Okay.
Yeah, thank you.
I will put the link in the chat.
Kate, you're experiencing one of my reoccurring nightmares when I show up for a meeting and find out I'm on the agenda.
I was like, oh, okay. I even texted Amy Murphy asking her if she knew, and she said no. So yeah, so okay.
Sorry,
Kate.
Sorry about that.
Sorry, Kate, we talked like a month ago, and I think it was actually Chris Case that was going to be on the agenda. So I don't know if,
okay.
Yeah.
Okay. All right. Thank you, Nicole.
Yeah.
I will let you know.
Okay. Thank you.
So we do have a, I'm going to put now I'm going to put other people on the spot in my reoccurring nightmare and put you on the agenda. But Shelley and Diane both, work in the public school setting. And I wonder if because 90% of the dollars were going to the local school districts themselves, if you have any examples of how any of the funding might be used to support early ed services or early childhood services, and you can pass.
I can share what we're doing in our area. So we have been we've been working on we have a continuum of instruction that talks about universal levels as well as moving up in terms of support. And so we've been working the last couple of years about what that looks like developmentally for early childhood. And so as part of that, having interventions or additional supports within a classroom that makes sense and are developmentally appropriate for that age group. And so we've been able to identify abilities to coach, which is using the pyramid model, as well as a variety of different tools and resources to create sustainability. And so what we have targeted is, and we have 9 elementary schools. And so the hope is when we work with those 9 elementary schools to increase the universal response to kids, that then it frees up some of our resources then as we go into our private partner programs and our homes and things like that. So we've targeting 3 of our school-based preschools over the next 3 years. And so that's been written into the plans for the monies that are coming to our supervisory union, as well as then each school has their ability to apply some of that. So that's what we're targeting.
Thanks, Diane.
And I would say in Champlain Valley School District, which is Charlotte, Shelburne, Williston, Heinsberg, and St. George, what they did for what's called the CERT plan, which is the recovery funding, where that is that we looked at the data in the areas that the agency wanted us to look at. And social emotional is the area where we saw a slight decrease in our TSG data. So everything that we're doing is driven by the data that we had. And so we're going to focus on continuing, and we have been doing this, and we've been doing it collaboratively through a couple different school districts. So Burlington, actually Head Start typically is part of the partnership. We are offering the pyramid modules to partner sites, and then we have early ed outreach staff who are doing consultations and programs and helping support that model. We haven't, ideally, we'd be doing the coaching to match, and we just haven't figured out how to fund that yet. So, but we are still focusing and using some of that recovery funding to maintain a series of the modules. So we'll be offering probably module 1 twice this year, and possibly module 2 if we can fit it in with our contractors. So.
Thanks for sharing. Does anyone else have any information related to that works with or partners with a school and do you have any questions for Shelley or Diane? Awesome. So Beth, I am thinking that even though you were next on the agenda, that we would maybe go to Trish just to keep that sounds great. The focus on the local, and then go, you were going to talk more on the federal level. So so I'm bumping Trish up in the agenda, and thank you for being with us and sharing what information that you have.
Well, good morning. I definitely feel like I'm not sure that I'm in the right meeting or have the right material, as some people are talking about. Trish Singer, I'm the Director of Adult Services at the Department of Mental Health, so I really don't interface with early childhood. Cheryl Wilcox is out today. She's on vacation, so she asked me to step in and talk about some of the funding opportunities we have. I do not know how many, because I don't really understand the early childhood system of care. I'm not sure how much this will actually impact you. We have gotten an increase in our federal medical assistance percentage, or FMAP, increase from the federal government, which enhances or gives us money to support services, support providers that provide services mainly through Medicaid, so the home and community-based services waiver. And so I don't know how many folks here actually provide services under Medicaid, but that is the
Trish, we lost you a minute. Trish?
If we lose her, I do have some other information that Cheryl's given me just to give an update.
Okay. We'll give her like 20 more seconds. Oh, Trish? All right. This never happens in in-person meetings. So Beth, why don't you give us the update from information you have from Cheryl about the funding for the Department of Health?
Sure. I could say that one of the projects that I'm right in the midst of is putting together a table that captures all of this funding that we're talking about. And so I am sorting through a huge amount of information, but do have some information from Department of Mental Health in terms of what relates to early childhood. DMH awarded, there was about $300,000 that went for emergency outreach grants. There also was about 850,000 that went to each designated agency to support additional case managers. There's been 150,000 that went to for training and wellness supports for frontline healthcare workers. There's about 4 million for healthcare facilities around to make existing housing and community-based services ADA compliant. Some of us may have heard about the mobile crisis intervention program that they're expanding. It's a pilot in Rutland with the hope that there'll be an expansion of that effort in the future, which is pretty cool. So trying to meet families where they are and where they need supports instead of having them come into the emergency rooms. So that's 600,000 for that pilot in Rutland. Very cool. So those are some of the primary things that I think relate to early childhood. There's a couple of others, but I think it's just important to recognize the work that this committee is doing is, yes, it spans the whole spectrum and that families need services in all different ways.
Thanks, Beth. Does anyone have any questions for Beth? It's great to hear that you're putting together a table. That sounds wonderful and overwhelming at the same time, but
Yes, I got a lot of information from ACCD, Agency of Commerce and Community Development. And so there's trying to sort through what might be helpful because there's a lot of different types of business supports. So trying to put that together. It's not ready for prime time yet, but hopefully will be in the next couple of weeks.
Thanks, Beth. And before we shift to Beth, I could do just a minute report on, we also know municipalities are getting funds, recovery funds, and childcare is an allowable use for municipalities as well. And the Vermont League of Cities and Towns and actual individual like select board members have been reaching out to Let's Grow Kids because they're trying to figure out how they might use them in that way. And so there's a couple ways it seems that is identified in some of the materials. Number one is they can offer premium pay to childcare programs in their area is one way they could invest. The other way is, to help increase capacity in their area. So and to incentivize programs to expand or start up. So, the challenging thing with towns and cities is, most of them are really small, led most by volunteers. They're really worried about doing something that isn't exactly right when you're talking about federal dollars. So that's some of the challenges, but the Vermont League of Cities and Towns wants to try to support that. And, we have heard from some communities that are starting with advocating just to set aside some money for childcare in their plan, and then working out sort of what would be the details of that in the few years that they have, to spend those funds. So that's another place where there is funding and available that may impact families and young children. So Beth, do you want to tell us what you know about at the federal level that's changing every 15 minutes?
Yes, so this is a little bit interesting. BBF is doing a dive into the proposed Build Back Better plan, which proposes significant investment in both childcare and pre-K. What's interesting is that Vermont is one of, I think, 24 states that already provides some type of universal pre-K. So certainly the hope is that, well, first of all, we have a great opportunity to provide guidance as they are writing this bill. And so we've been meeting with education partners and agency partners to try and collect some information to identify what is worth sharing about what works for Vermont system, with the hope that if if and when things are passed, that it is complementary and can build on our current system, and instead of being overly prescriptive. And it, from what I hear, kind of from the very high level, it sounds very hopeful that there's a real investment in pre-K as a mixed delivery, that there will be allowances, or that it's being written so that pre-K investment can be done in multiple settings. So that would complement our existing mixed delivery model. So that is one piece. Certainly that it's, that there would be some state match. So again, what that match dollars would be, and that is incremental, kind of a step back from federal investment to state investment over time. So those are some of kind of the very high level pieces. It is changing pretty quickly. So even our deep dive that we did a couple weeks ago, is changing, though it sounds, promising that pre-K may stay in there when other things may need to be pulled out. I don't know if there's other folks who have been following the Build Back Better plan and the components of early childhood that you want to share, kind of what's exciting for you, or if there's questions that folks have. But certainly it feels like an amazing opportunity, and to really leverage what we are already doing within the state for 3, 4, and 5-year-olds who are not yet ready for kindergarten, and wanting to maximize that opportunity. Any other observations or questions from folks?
Beth, can I just mention a couple things?
I'll say, I don't know if I can answer, but you can ask. Yeah.
No, well, these are more observations. First of all, yeah, it's definitely want to balance the amazing potential and possibility with reality and devils in the details part. So I know those of you who know me, it's hard for me to start with the positive. So trying to start with the positive, right? A couple of observations that folks have made, one that I made and one that someone else I heard made. In terms of the state match, it's really big in one of the versions that I saw. So I think people know what's going on is that there's this intense negotiation going on in Washington, D.C. about how big this package should be, how long it should last, whether they do a lot of things for a few programs or less for more programs. It's all very much up in the air. But one of the drafts I saw had a really very substantial state match being required. And I think we all just collectively, regardless of where we sit in the system, whether we're in the state government or advocates or providers, we just need to keep that in mind. And that's going to be a big conversation. The other sort of reservation that was voiced was this tension between the childcare piece and the pre-K piece, and also the tax credit piece, but particularly childcare and pre-K. And the question is, if it's just the pre-K piece, we get to that issue that we have in Vermont that we've talked about a lot, about the viability of the childcare system as a whole, the business plans, the financial interaction between 0 to 3 and 3 to 5, and the interaction between 3 to 5 generally and pre-K. So there are some real sort of not way in the weeds, devil in the details pieces that we'll all, I'm sure, have very energetic discussions of if the bill passes, if the funding's in there. So I think people should definitely stay tuned. There's a lot of stuff here that really will impact everyone on a day-to-day basis. And I know that the folks in the administration are very eager to have this conversation with people, so we can hope for a really good energetic discussion about, should the good news really come true, about how to apply this, as Beth, as you said, the federal mandates and the federal restrictions, how they apply to us. And it'll be a very energetic conversation going forward.
Absolutely. From a very high level, the proposal is for free universal pre-K for all 3 and 4-year-olds. That was the proposal. So again, some questions that came up. What about the 5-year-olds who are not in kindergarten? Those types of things, right? Certainly a goal for families to save money, which is amazing, and requires UPK delivery is universal, high quality, free, and inclusive. So looking at high quality benchmarks, developmentally appropriate curriculum, et cetera. So the proposal is pretty exciting, and we will see how things shake out. If they feel like we knew that they would change from the point where it was proposed to where there's actual discussion, and we'll continue to track it. But we've put together memos and communicated that to our federal delegation. And so really trying to keep open lines of communication so that what we know it works on the ground in Vermont can at least educate our representatives.
Thanks, Beth.
Yeah.
So does anyone else have any questions? We were a few presentations short, so we are getting toward the end of the meeting. So I'm going to do some little updates and then want to have pick a closing question to discuss for a little bit. And I think I wonder how what we learned today can inform our work, or if there was anything today that you heard that was surprising. So those are two things to think about and maybe share toward the end. So I want to remind people we do not have a meeting on November 11th. Instead, we have the Early Childhood Systems Analysis Advisory meeting for November, and that's on the 17th, and that's at 1:30 to 3. You should have a link to that, but that will take the place of our ELD meeting. And then in December, we will have a follow-up meeting with the UVM team about their report, and I will use some of the questions you shared with me in the beginning to help them think about how to set up for a great discussion, and with an eye toward what are some action steps or recommendations that as an ELD committee we can get behind after hearing more about that. And then in January, I think this is correct, Beth, that a portion of our meeting will be the How Are the Children report. Will it be ready in January? Is that what we?
Right, so we will publish the state of Vermont's children, and would love to present and review some of the data that's in there around child development and education in particular.
So that gives you just a little taste of what's coming up in some of our future meetings. And also, if there's any topics that you want us to bring to the meetings, just to reach out to Nicole or I, and we can find the best people to share the information that you're looking for. Yes, Kate would like to. Yes, Kate, I will add you. And then I wonder if anyone had anything they wanted to share to wrap up the meeting, specifically around how this can inform our work, or something more you want to know, or something you heard today that was surprising or interesting.
Sherry, this is Trish. I'm sorry I got cut off. I don't know how much of what I said you even heard, because I was talking for a while on documents, and then I realized there were no questions because I was no longer on the Zoom call. And I apologize. And like I said, I'm not sure what you heard or didn't hear about the FMAP funding opportunities. It is primarily for Medicaid providers, so I don't know how much that overlaps this early childhood group. I'm happy to give any information that, like I said, but I don't know when I fell off the call.
You fell off very quickly, Trish, and I'm sorry, I didn't see that you had. I looked for you for a long time and I did not notice you were back. But okay. Beth had some information from Cheryl for another project she was working on, so she was able to share some information. So thank you for signing back on. Sorry for the technical difficulties.
Yeah, I am sorry as well. Cheryl will keep you up to date with opportunities. Basically, there's some monies for Medicaid providers. It's still pretty ill-defined. We're still working to categorize it. Eventually, there will be RFPs available where people will be able to apply for those funds for their particular project. And like I said, Cheryl will be a great link to that so that you will not miss out just because I wasn't able to figure out how to use Zoom today. Sorry about that.
Thank you for coming back on and giving us that update. Completely understand. We've all had Zoom challenges for sure. Is there anything else, any other questions or sharing that anyone wants to offer before we?
Yes, Sherry, I have one.
Yeah.
Just as we're
Yes.
talking about universal pre-K, and let's hope we have this problem if the funding comes through, that we already have a shortage of licensed pre-K teachers at this point. And just, thinking ahead to that, anticipating even more opportunity for folks in the field to think about alternative routes to licensure and so forth. So just something to start thinking ahead now to the future when we already have this workforce shortage, but there'll be an even larger one when we can serve the 3-year-olds and universal, and maybe even longer days, so forth.
Yes, thank you, Anne. Thank you. And I wanted to thank the childcare programs that are on today too, Sonia and Danielle and Lori, who are filling in for their staff, doing COVID testing. The workforce shortage is so real. So I appreciate every effort you make to be a part of this conversation because you are essential to these discussions. So, and don't ever be sorry about coming in late or leaving early or talking to a kid in the middle of the meeting, any of that. We understand and appreciate your attendance.
So true. And I just wanted to jump in that the State Advisory Council meeting on October 25th, we're going to focus on workforce shortage. We have data from multiple sectors that will actually be included in the state of Vermont's children this January, but as a preview, we'll talk about that issue. So the agenda is not out yet, but the registration's there, so you can get the Zoom link if you want to join.
Great. I just have an announcement. Let's Grow Kids is working on putting together an ARPA webinar for programs, for childcare programs on October 29th at 1. So, in hopes of just sharing information and specifically having experts that are, related to human resource issues and, business functions in terms of how it might impact your programs in that way. So with that, there'll be an announcement of that. We're pulling that together right now, but that'll be an opportunity to explore some of your ideas for the ARPA funding and make sure you're, have some resources to think about how that may impact your business operations or other HR functions. So we'll have that coming soon.
Lori, did you have your hand up?
Yes, thank you. And thanks for your understanding. And I'll try to remember to mute while I'm multitasking again. So that was my embarrassing moment for the day, but I'll own it. Too many things happening at the same time. I was afraid I would forget to tell her. I had a couple of questions about the ARPA funds, the town funding piece that we touched upon, only because one, and I think the answer is no, it's separate. If you receive, if the town designates a certain amount for childcare, because that's one of the things, and there's actually many categories of the town funding that most early ed programs would fall under. I need to put that out there because I feel like it's a potentially an untapped resource for programs. So I just think it's important that we're really well aware of that. If we were to get, some designation from town or city funding for childcare programs, would that prevent us from also getting the non-discretionary ARPA funds through CDD? No. Okay. And the other thing is, I'm just wondering if there's a need or if there would be a benefit or if it would fall under somebody's job to like track what towns and cities are doing with that money in regards to early childhood education or children and families in general. Because sometimes for some towns and cities, it may be easy to go to your town officials and say like, listen, this is what they're doing here. What do you think about us doing something similar there? Or just in general, like having some idea of like what's happening across the state. And, or is there some like unified advocacy that towns and cities really do look and prioritize childcare as part of their funding? So those are some questions I'm wondering about.
So Lori, the Vermont League of Cities and Towns are trying to play that role of bringing together leadership in the municipalities to either share ideas or come together. They may come together to make an investment in an area that may be on a commuter route that would serve a lot of their communities. So so there are people trying to work on it. The challenge is that there's so many cities and towns. That's one thing. I believe there's kind of a short timing for them to get their plans approved. Plus they have to get them approved by their city. So people are kind of working on it. It is challenging. I attended a national webinar on it, and it was like the same things that are happening in Vermont were happening in like much larger states in terms of like trying to get your arms around how to support how to reach out to that funding. So I think, but I do think the Vermont League of Cities and Towns is trying to proactively, they asked us for information for a fact sheet to get to their constituents. They're talking about doing something informational on a webinar. I'm not sure that will, each city and town is kind of unique and, what might be their needs or, everyone needs childcare, but what might fit in there. So I'm not sure they'll do that, but there is work, and it's great that programs like yours know about it and can advocate for some of those funds be used for childcare. There's also this is just a little fact sheet that does outline the primary uses for cities and towns. And I did have one select board member who was really trying to advocate for her town to put some for childcare. And she said that like the broadband companies are, actively pursuing these dollars, and we need broadband also, but she just feels that other potential investments are being overlooked because towns are a little overwhelmed with the amount of money, how to get it out, how to do the right thing, and they are being delivered a package that they feel they could just allocate to. So that was one of the challenges she saw with making sure money was designated to childcare.
It just seems like a great time to partner in that way. I know that's been a long-term goal of Let's Grow Kids, especially like engaging with local businesses, right? And getting their support and their investment. And, this right now it seems like a prime opportunity for us to do that, statewide, locally, regionally, and also to just, sort of support people in doing that as well, advocating with their towns and cities as well. And for the purpose of this committee of seeing like how that's all interfacing, right? Like how then do all of these different parts interface with one another?
Mm-hmm. Yep. Any other questions or feedback before we close the meeting?
Sure, I just have one question around the municipal funds. I haven't seen the fact sheet or even really looked into that. I'm very interested in it. Just wondering if those funds so in Lamoille, there's a group that's actually has done a project before similar to sort of the pre-apprenticeship piece that's happening in the tech centers, only they've done it with Reach Up recipients that have been interested, and they've created, it's almost like a parallel program that they've been discussing. And we're actually considering some of the BBF funds to apply to do internships with these folks and support other pieces. Do you feel like the municipal funds might be like for pipeline development like that, you know, would they be appropriate for that, do you think, or?
Well, if I did put the link in, and this was one of the reasons when the Vermont City League of Cities and Towns wanted me to participate in a webinar. I'm like, oh my God, like I do not understand the legal issues around how municipalities can spend their money like that. I'm like, that's what's going to happen. And I don't have time to learn it all, but it talks broadly like about capacity. And if you need staff for capacity, then I would say, how does that not fit? So it's somewhat broad in most of the documents I've seen, but I'm not an expert, but I do think the Vermont League of Cities and Towns is trying to get really up to speed, and they're very interested in childcare as an investment. They think that's, essential to the growth of Vermont, and that's really, so there. And, there's some other agencies, also linked to municipalities that have reached out to Trey Martin, who also works for Let's Grow Kids. So there's a lot of buzz around it. It's the pace at which, the decisions need to be made that is part of the challenge. But if I was a childcare in a town or city, I would approach them to find out how they're using their funds and have they considered it, an investment to shore up some childcare.
Yes, thank you. And I see your link. I'll look at that. Thanks.
Yeah, great. Anything else before we sign off? Thank you everyone for participating today. It's a great time of opportunity for sure with the funds coming. And one of the things I didn't get to ask is, I'm curious to know how we'll track some of the impact. It would be great to show the investments that maybe should be further continued because they have real results. So that's a follow-up question that I have in wondering about some of the programs.
Great question. Thank you all.
Thank you all
for facilitating.
Hey, thank you.